The big shift in the past 10 years, kind of like I alluded to with cardiac surgery, how it's become less invasive, is facial rejuvenation. So facial rejuvenation, the shift has been away from the old, pulled, tight facelift that most people think about. When they think of facelift surgery, they think of these overstretched out faces. And what we've learned as we've studied really the aging face is that it isn't gravity that's causing the sagging tissues as we age. And it happens more pronounced in women than men, but what's actually going on is there's a volume loss in the face. And so the shift now is we need to just put back fat, restore the volume that has been lost. That's where you get the non-surgical aesthetic treatments. And I like to think of it in terms as the change in aesthetics now isn't 40-year-old women don't want to look like they did when they were 25. Because you know what? When you're 40, you're still a very beautiful woman, but 40-year-old women want to look good for their age. They want to look refreshed. They don't want to look tired.
And what I'm thinking, and I'm going to make a little note of it in your chart, is I'm thinking you're going to need at least 2 full syringes of Radiesse, and that's going to give you kind of an augmentation of your cheeks. So you see how that kind of softens it quite a lot? People think that just filling this is going to make it better. And what I found is by doing a little bit of a cheek augmentation here with that Radiesse filler, then you need a little less to get rid of that, and that can also help turn up the corners of the mouth like just a little bit. What questions do you have for me?
Honestly, I'm just grateful, really grateful. Okay, so you were saying the only thing that really bothers me a lot is this severe line. I feel like there's one really severe one here and here.
These are permanent lines that have already started to form from the wrinkles. That's why I was saying it's important once you start using Botox to prevent the formation, because there's what's called active wrinkles of expression, which is like if I act surprised, you can see a little wrinkle, but if I'm normal, you don't really see anything. And then you have what are called static lines of expression, which means that they're there. And you can't get rid of them.
If you start using Botox, for example, everyone knows what Botox does. It paralyzes the muscles in your face so you don't make wrinkles. If you look at a young woman in her 20s, they don't have wrinkles. By the time they're in their 30s, they've started forming little lines here in the middle and across their face from their expressions. It's just natural expressions that lead to the formation of these lines. By paralyzing the muscle, you prevent those lines becoming permanent. And that's how you start slowly shifting the way people age, so that, you know, fast forward 10 years from now, if that person's maintained themselves with Botox, they're not going to have the wrinkles that maybe someone their age would have otherwise.
And I think now that you've had the chance to do this whole makeover, obviously they're working with you on your diet and your exercise, and I kind of tell people that once you get started on this land of fillers and Botox, it's kind of like when you get your hair colored. It's a maintenance. It's kind of like your exercise regimen. It's kind of like, okay, 3 months, time to get my, my roots are coming out, and time to get my Botox done. And, I mean, we have some pamphlets that I'll send you with today, so you can read a little bit about what we're going to do. Well, if you think of anything, write them down, so that way when you come back to see us, you'll have them.
Okay, all right. Thank you so much.
You're so welcome.